Hello everyone, welcome back to my channel. So in this video, we will be discussing about anti-cancer drug, and the first group we will be discussing is alkylating agent. So what are these compound do? So they produce a highly reactive carbonium ion intermediate, okay? And what does this intermediate do? They transfer the alkyl group to the cellular macromolecule and they form covalent bond, okay? And the position 7 of guanine in DNA, it is highly susceptible. So though other molecular sites are also involved, so how does they do? Because alkylating groups, alkyl group, they don't have H hydrogen, they are devoid of hydrogen atom, so it will bind to the free hydrogen atom which is present at N7 of guanine, okay? So alkylating agent, what will it do? So if there is binding of this, the abnormal guanine and thymine pairing will be affected and abnormal DNA will be produced. So alkalization causes cross-linking, abnormal base pairing, secession of DNA strands, okay? And most of them, they are cytotoxic and they are non-specific, non-cell cyclic specific drug. And what does that mean? They will affect both the dividing and non-dividing cell, and they have CNS stimulant and cholinergic properties as well. Now we will be discussing about individual drug. Michlorethamine, that is Mistrin SCL, it was the first nitrogen mustard which was used, and it is highly reactive and it produces acute effect. That's why it is not used now systemically. Occasionally it is used as a topical application on cutaneous T-cell lymphoma, okay? The most important drug in this group is cyclophosphamide. It is inactive as such, okay? It is kind of a prodrug. So and it produces few acute effect. In liver, it is produced into an active metabolite, that is aldophosphamide, okay? And it has wide range of anti-tumor suppressant property, and it is one of the most potent immunosuppressant. That's why it is most used alkylating agent in solid tumors, okay? And it is less damaging to platelet as well. So the neoplastic use of this drug are like in pediatric solid tumor, Wilms tumor, neuroblastoma, breast cancer, ovarian cancer, okay? Now Iphosmite is a congener of cyclophosphamide, and it has a longer and a dose dependent half-life, and it has found utility in bronchogenic cancer, breast, testicular, head and neck carcinomas, and it has a greater neurotoxicity than the other alkylating agent. And there is mesna, that it is a SH compound to protect the bladder, because we are giving mesna along with it, okay? Because mesna is excreted in urine and it will bind and inactivate the toxic metabolite of ifosfamide and cyclophosphamide, okay? And this causes less hematogenic than cyclophosphamide, right? So now the another drug is chlorambucil. It is very slow acting, especially it act on the lymphoid tissue, okay? It is the drug of choice, we have to remember. This is a drug of choice in long-term maintenance therapy for chronic lymphatic leukemia, CLL, okay? CLL, we have to remember chlorambucil, and non-Hodgkin lymphoma, okay? And melphalan is very effective in multiple myeloma. Also it is used in acute myeloid leukemia, and it is used in advanced ovarian cancer and bone marrow depression. These are the most common toxicity or the adverse reactions which are caused by it, okay? Now Bendamistrin, it is indicated in chronic lymphatic leukemia, and we had discussed what is the drug of choice for CLL. It is chlorambucil, okay? And the myelosuppression caused by Bendamistrin reverses rapidly, okay? So it is very rapidly degraded, okay? And it's the plasma half-life is 30 minutes, okay? Now ethylamine, it has two, thiotepa and etratamine, okay? So thiotepa, there is no need to form an active metabolite, क्योंकि जो thiotepa होता है, that is in an active form, okay? And it has a high toxicity, so that's why it is only used in ovarian and bladder cancer, okay? And etramine, it is hexamethyl melanamine, HMA, which act by alkylating DNA and protein, okay? Altetramine is indicated in recurrent ovarian carcinoma, and the major toxicity that occur because of use of etratamine is bone marrow depressant. Kidney dysfunction is dose limiting toxicity of altetramine. Now the alkyl sulfonate, in which we have Bisulfant. It is highly specific for myeloid element. Myeloid element we had studied in physiology, like granulocyte precursor. Firstly, that is most specific for granulocyte precursor. After that, we have platelet and then RBC. It has a specificity for, and it is hyperuricemia, that is common because of that. And the question that has been asked so many times is pulmonary fibrosis. That is an adverse effect that has been caused by Bisulfant and spin pigment. Now the second choice drug to imatinib for chronic phase of myelocytic leukemia is Bisulfant. Okay, now the nitrosurias. So these include Carbamazepine, okay, lomustine, simustine, and they have a highly the question asked is which of the alkylating agent they can cross the blood brain barrier. So they are highly soluble alkylating agent with a wide range of anti-tumor activity, and they can cross blood brain barrier, so they can be used in meningeal leukemia and brain cancer. This question has been asked. Okay, and the adverse effect are bone marrow depressant, characteristically delayed, taking nearly 6 weeks. Okay, and the drug we had discussed which are present in it are Carbamazepine or lomustine, and also there is another, that is simustine. So now the another class of drug that is included in alkylating agent, and these are the agent which act by DNA methylation. Okay, so these are Carbazine, that is DTIC. After activating in liver, it acts by methylating the DNA and interfering with the function of it. Carbazine is used in combination regimen for Hodgkin disease and in malignant melanoma. So, okay, and also there is another drug, that is procarbazine, that has been included in this methylation group. Okay, and temozolomide, it is orally active tyrosine methylating agent. Okay, and it is the drug of choice for brain tumors like glioma. Okay, and ADRs are like Carbazine. Okay, now procarbazine, we had discussed that it is not a classical alkylating agent, but it also has some similar property. So after activation, what does it do? We had discussed ki ye methylate karta hai, and then it depolymerizes the DNA, and there is a chromosomal damage. And component of combination regimen for Hodgkin lymphoma, also the carbazine was also the combination for the regimen of Hodgkin disease, and it is alternative for brain tumor like of tolozomide, and it is a weak monoamine oxidase inhibitor, produces sedation and other CNS effect. That's all for this video. Thank you for watching, and please subscribe and hit the bell icon. Thank you.